Hey everyone, so today we are back with another topic, that is giant cell tumor or osteoclastoma. This is one of the most important and a very common bone tumor. It is a benign tumor. It is important to note that it is a benign tumor, but it is a locally aggressive tumor, that is it behaves as a malignant tumor. What is the most common site of the occurrence of this tumor? Let's see the most common site where it occurs. It occurs in the epiphysis of the long bones. Epiphysis is nothing but the end of long bones, ends of long bones close to the articular cartilage. So we know that ends of long bones contain articular cartilage, and the tumor most commonly occurs at this part, that is epiphysis, close to the articular cartilages. The most common sites involved are lower end of femur and upper end of tibia. So this is the lower end of femur, which is the thigh bone, and upper end of the tibia, which is the shin bone. So basically it occurs around the knee joint, that is both the articulating surfaces of knee joint, that is femur, lower end, and tibia, upper end, is where there is occurrence of the tumor, that is giant cell tumor. Age of the patient suffering from osteoclastoma will be usually around 20 to 40 years old. That is, most of the cases seen are usually in this age group. And there are both equal cases in both males and females. Talking about the clinical features at presentation, that is, if a patient is complaining of these following features, we may suspect that it may be a case of osteoclastoma. So what are those clinical features at presentation? We see pain that too especially on weight bearing and movement usually on walking, running, or weight bearing, that is mere standing, may also cause pain sometimes. And there is also swelling. Swelling may be mostly seen in and around the knee joint, because that is the most common site involved here in osteoclastoma. So there may be swelling and pathological fracture, that is due to destruction of the bones, there may be more chance of fractures. So these are the important clinical features which are seen at presentation. Now let's talk about the radiological features of giant cell tumor. Giant cell tumor appears to be as a large, lobulated and osteolytic lesion at the end of an expanded long bone. So when we take an X-ray of the knee joint of a patient suffering from osteoclastoma, it appears the end of the long bone appears to be expanded like this, which is nothing but like a soap bubble appearance. That is the most common characteristic feature of radiological features of the giant cell tumor, that is, there is expanded end of the long bone. Now coming to the morphological features. Morphological features, that is in gross appearance, when we see the bone as such of a patient who has suffered from osteoclastoma. So the gross findings are usually the location is in the epiphyseal end of the long bone. So as we have already seen, epiphyseal end, that is end of the long bone, is the site where it is involved, and the bones are expanded. That is, we have already seen here, there is soap bubble appearance due to expansion. This is the end of a long bone. That is a gross appearance of a person who has suffered from osteoclastoma. The end of the long bone is relatively expanded. And as we have already seen in the beginning, that the tumor is benign. So here we can see that the tumor is circumscribed. Usually benign tumors are circumscribed, and it is dark tan in color. It is covered by thin shell of subperiosteal bone. The cut surface of tumor, when we cut the bone like this, we can see the cut surface of the tumor, which is hemorrhagic, necrotic and honeycombed. Hemorrhagic, all the blood clots, and necrotized and honeycombed appearance. So this is the image which we can clearly appreciate that there is honeycombed appearance with all the blood clots, and these are the blood clots, and this almost blackish appearance which we see in this picture may denote the necrotic areas, and all the reddish areas almost, they indicate the hemorrhages. Now let's look at the histological features, that is when we observe under the microscope. The features which are seen are now described. So under microscope, if we see, there is presence of large multinucleated osteoclast-like giant cells. So this is the normal appearance of an osteoclast. So in giant cell tumor also, we can see the osteoclasts like giant cells. These are osteoclast like giant cells which are multinucleated. So all these giant cells are scattered throughout the stromal cells. They are randomly scattered throughout the stromal cells. These almost multinucleated osteoclast like giant cells are scattered throughout the stromal cells. These giant cells are they just consist of 100 benign nuclei, almost about 100 benign nuclei, and they resemble the osteoclast in appearance. The normal osteoclast looks like this, almost like a giant cell. They resemble the normal osteoclasts. They have high acid phosphatase activity. That is, in the presence of an acidic medium, they have more phosphatase activity. That is, they are able to release more phosphate into the blood. Now let's talk about this stromal cells. In the simplified diagram, we can see clearly there are giant cells and other cells. These are mononuclear cells which are scattered throughout, which are nothing but the tumor cells. Real tumor cells or the mononuclear cells, they're almost uniform and they're plump. They look like almost bean-shaped structures, spindle-shaped they are, and they are the actual tumor cells. And as we already know in the basics of pathology, that the normal tumor cells usually contain the mitotic figures. So these stromal cells also consist of mitotic figures. So this is about the stromal cells, which are the actual tumor cells. Then talking about the stroma, apart from these cells, stroma also consists of collagen, very minute quantities of collagen, and it is highly supplied with blood vessels, so it is very, very vascular, and there are areas of hemorrhage. So that's why in gross appearance we can see the honeycombed appearance, that is due to hemorrhages, and there are also presence of macrophages. An important point to note is that though we call it as a giant cell tumor, but the actual tumor cells are the stromal cells, and these giant cells are just seen as the background cells. And these tumor cells or the stromal cells are believed to have a mesenchymal origin. Now coming to the pathogenesis of this, there are cells called as primitive osteoblast precursor cells, which are actual neoplastic cells. They rapidly divide and there are more formation of primitive osteoblast precursor cells, and which express rank ligand. So there is also overactivity of rank ligand, which will promote the proliferation of osteoclast precursors, which will differentiate into osteoclast mature cells, and there is increased activity of rank ligand, which causes bone lysis and bone destruction. And as we already know that these are benign tumors, but they are very aggressive and recurrent tumors. They are usually managed by curettages, but they recur. Curettage here is a surgical treatment or surgical removal of the tumors, but there is 40 to 60% of chances of recurrence even after curettage. And there's also chance that 4% of the cases even transform into malignant and they undergo metastasis to the lungs. Coming to the treatment, treatment here is a drug called as denosumab, which is a monoclonal antibody. This monoclonal antibody which helps in tumor reduction and even it helps in bone formation, and it causes even the decreased expression of the rank ligand. So there is here, as we already know, there is increased activity of rank ligand. It decreases the activity of rank ligand and helps in bone formation. So that is all about osteoclastoma or the giant cell tumor. Thank you. Please like, share and subscribe.